So Cx360 Intelligence is an AI-powered clinical support platform, and it can be integrated in an organization's current EHR or as a standalone EHR. And it really consists of powerful tools. It assists the workflow of providers. It helps to ensure clinical quality and compliance, and it can help make meaningful sense of client data to enhance outcomes. Clinical documentation can oftentimes be quite burdensome for many providers. Me being a clinician, there are plenty of times where I'm seeing back-to-back clients and I have to make a tough choice in between sessions of, do I take 5 minutes to go to the bathroom, or do I eat a quick snack, or do I chart review for my next person who's coming in? So it's really difficult to be able to keep up with documentation. I've spent long hours after I finish work just to be able to catch up on notes to ensure that I remain compliant. And there are many of providers and organizations that unfortunately it's hard to be compliant because of all the documentation they have to keep up with and they have to conduct. And so Cx360 Intelligence helps to improve clinical documentation through ambient documentation. And so what happens within the system is that when you capture a client session, you have the ability to transcribe everything that's being said within the session. And then we have an AI model that takes that transcription and generates a note. And so it makes clinical documentation easier. It helps ensure that each note is individualized, that it's pertaining specifically to that client session, and it helps alleviate the burden that providers have to go through in constantly keeping up with all of their documentation practices. We always ensure that providers validate all outputs. We have safeguards in place to make sure that providers see and review all the information and ensure that it is all entirely accurate before they save and upload to the client chart. Cx360 Intelligence has multiple tools to be able to help providers with their day-to-day work and with their practice overall. Through the AI-powered features, you're able to synthesize all of the client information through summaries. By having this information, you can understand the client from a holistic view. You also have the ability to use the Ask Me feature, which allows and enables providers to be able to ask any question about the client and be able to have that information populate. Because everything is connected within the system. That's all the treatment notes, that's all the treatment plans, that's the documents, that's the transcripts when you're capturing sessions. So Cx360 Intelligence can take all of that information and provide it all at the hands of the provider anytime that they would like. And that helps to enhance client outcomes as well, because you're able to understand, well, what can work for this client, what may not work for this client. Help me understand a little bit more about what this client is struggling with. And all of that combines to be able to help and drive client outcomes. Oftentimes, what can be really difficult for a lot of providers within their practice or organizations as a whole is creating a person-centered treatment plan. Why that can be difficult is because of the time that it takes to create that treatment plan and building that hierarchy. Because it is clinical best practices to build a hierarchy on a goal, an objective, and an intervention. And that takes time. That takes a lot of time out of a clinician's schedule, and that takes a lot of time out of an organization as a whole. And so we are enabling an easier way to create treatment plans within Cx360 Intelligence. How we're doing that is AI is taking a look at all the notes within the client chart, and it's identifying all of these problem areas and all of these goals and objectives and all these needs from all of the notes. And so all the clinician has to do is to click on these problem areas, these identified needs, and the system generates a treatment plan, and it builds that hierarchy for the clinician. It builds the goals, the objectives, and the interventions that are all based on evidence-based practices. And it builds it to be able to have a consistent, compliant, and robust treatment plan. So Data Explorer is such a powerful tool within the system. It enables providers and organizations to have a holistic understanding of all of the clients that's within their caseload, or all of the clients that are being served. A Data Explorer, you can generate actionable insights through Data Explorer. You can ask any question and it can populate and generate that answer. So I could ask even population health related questions. So if I want to ask which one of my clients are at risk for failure to thrive, It can generate responses and identify what individuals that I'm currently be seeing as me as a provider or across my organization who are at risk for failure to thrive. If I want to ask a question of how many of my clients have not had a decrease of 5 points within their PHQ-9 scores in the past month, it can help generate that insight. And then I can ask a follow-up question of what could be helpful for these individuals, for these clients. And then again, AI could continue to prompt and answer these questions. And it goes so much further than this as well. I can ask questions related to quality. How many individuals that I'm currently seeing do not have a safety plan, but have indicated risk? Those are the types of things that Data Explorer can help to generate. And again, it's that actionable piece. It's making meaningful understanding of all the data across your caseload, across all the clients that you're seeing. One feature that Cx360 Intelligence has that helps to enable clinical quality is note auditing. So within the system, you can generate a note based on a client session. And then we have clinical quality parameters that are preset that you can also change and edit based on your organizational needs. And you can audit that note based on those clinical quality parameters. So for example, if your note may be missing a justification for medical necessity, which is required by many commercial and government payers and funders, the system can inform you that you're missing that part of the note. There's no indication or justification of medical necessity within that note. So it's such a powerful clinical quality tool for providers to be able to see, how do I improve the quality of my note? How can I make this note better and aligned with the requirements that are necessary for all of these payers, for all of these funders? So I am a clinical psychologist by background, and I joined Core Solutions in early February. And I joined for many value-based reasons, but one of which is I joined because of the ethical AI practices that Core Solutions follows with their product development process. That was big to me. That's huge to me as an individual, as a person, as Mike as a person, and that's huge to me as Mike, the clinical psychologist. I want to always ensure provider safety and client safety, especially as sometimes it's the wild west of AI out here. And so when I say that Core Solutions practices responsible and ethical AI practices, what I mean by that is the product development process incorporates co-creation with real clinicians. There is clinical validation of all outputs. And also we are refraining from using any PHI to train our AI models. We have a lot of clinical safeguards in place to ensure that patient privacy is respected and that it is safe for patients and for clinicians alike. Core Solutions also has established an AI advisory board, which is major for many AI governance policies. And so I am proud to say that I work at Core Solutions in helping to develop their AI-driven products because of their emphasis on creating responsible and ethical AI. Based on all of the information within the client chart and based on all of the session notes, the system is able to identify the symptoms that are most pertinent and that tend to come up repeatedly throughout different client sessions, and then make a recommendation of an assessment tool that could be beneficial for that client. So for example, if a client has been repeatedly reporting depressive symptoms and anxiety symptoms, the system will pick this up, identify it, and then recommend that the clinician administer a GAD-7, a PHQ-9, a Beck's depression questionnaire. It can make those recommendations. Also, if it may be picking up and identifying maybe some symptoms of a potential eating disorder or bipolar disorder, it can recommend those assessments as well. So we're helping to enable measurement-based care by giving providers a way to see what assessments could be most helpful, and then within the system itself, providing that assessment for them to be able to complete. Part of responsible ethical AI practices is to keep a human in the loop when warranted. And in the case of behavioral health services, providers need to be in the loop for their direct clinical work. So yes, we have ambient documentation where providers are able to generate a note, a SOAP note, a DAT note, a burp note based on their client session. But we always want to make sure that providers validate that note, that they sign off on the note. By no means will we ever capture a session note and then just immediately put it in the client chart. We want to make sure that everything is accurate, and we want providers to be the final decision maker for these really important and crucial roles. And yes, we also have one-click treatment plans where you can create a treatment plan and generate a treatment plan based on needs and problems, but we want to make sure that providers are validating everything that's within that treatment plan. It is crucial that humans are kept in the loop, that providers are kept in the loop. And again, a large part of that is because it is part of responsible and ethical AI practices. Cx360 Intelligence is such a game changer for behavioral health organizations in many different ways. First, it really assists the provider workflow as a whole. It takes all of the information about clients, and providers are able to have AI generated summaries. They're able to have AI notes automatically generated as well. Providers can ask questions on the client so that they don't have to sift through pages and pages of notes, and it makes just everything a lot easier as a whole. Also, it ensures clinical quality and compliance. You have note auditing capabilities within the system. You're able to identify risk a lot easier by having AI see those risk indications populate, and they could be identified. And you can also have all the necessary documentation when risk has been identified. You can make meaningful sense of all the client data to enhance outcomes. You see, there isn't a data capture problem in the field of behavioral health. This comes up quite a bit. There's actually a data synthesis problem, and Cx360 Intelligence enables providers and organizations to use their client data in a meaningful way.